Is vaginal dryness just part of aging? Or could it be something more? Many women dismiss the early signs of vaginal atrophy until intimacy becomes painful or urinary infections won't stop coming back. Today, let's talk about the symptoms you need to know. Hi friends, Dr. Emily here, your OB-GYN and hormone specialist for clear, honest women's health guidance. Welcome back to Vaginal Atrophy 101. In episode 3, we uncovered the hidden triggers of vaginal atrophy. Now, in episode 4, we'll discuss the early warning signs and symptoms so you can recognize this condition before it takes over your quality of life. First of all, vaginal symptoms. The most common and earliest sign is vaginal dryness. Women often describe it as feeling less lubricated or tight, but dryness is just the beginning. Other local symptoms include a burning or itchy sensation inside the vagina, a feeling of fragile tissue, sometimes with spotting or bleeding after sex, thinner vaginal discharge, often watery or yellowish, a sense of tightness or loss of elasticity. Many patients tell me, "Doctor, I feel like my vagina is shrinking." That's not just in their imagination. It's the actual tissue becoming thinner and less flexible. The second, symptoms during intimacy. Perhaps the most distressing symptom is painful intercourse, also known as Dyspareunia. Without estrogen, the vagina loses its natural lubrication and elasticity, making penetration uncomfortable or even unbearable. This often leads women to avoid intimacy, not because they don't want to, but because they fear pain. Over time, this can cause tension in relationships, guilt, and even depression. Vaginal atrophy isn't just a physical condition. It has deep emotional impact. The third, problems with urination. What many women don't realize is that vaginal atrophy affects the urinary system too. This is why the modern term genitourinary syndrome of menopause was created. Symptoms may include frequent urinary tract infections, UTIs, urgency or burning when urinating, urinary leakage, especially when coughing, sneezing, or exercising. All of these happen because the drop in estrogen affects not only the vaginal lining, but also the urethra and bladder tissue. The fourth, psychological impact and quality of life. Beyond the body, vaginal atrophy often leads to anxiety and low self-esteem about intimacy, relationship strain, when sex becomes painful or avoided, a feeling of losing womanhood, as some patients describe it. This is why I always remind women, you are not broken and you are not alone. These symptoms are common, but they are also treatable. So, when you need to see a doctor. If you experience any of these signs, dryness, burning, painful sex, or recurrent UTIs, it's time to talk to your doctor. Don't wait until the symptoms get worse. Vaginal atrophy is easier to manage when caught early, and treatments can make a huge difference in comfort and confidence. So here's the truth. Vaginal atrophy is not just about getting older. It's a medical condition with clear symptoms, and if you notice them, you should never feel embarrassed to seek help. In episode 5, we'll explore how doctors diagnose vaginal atrophy, including what to expect during a gynecological exam, and how we differentiate it from other vaginal conditions. Remember, recognizing the symptoms is the first step toward reclaiming your comfort, your intimacy, and your confidence. And don't forget to like, share, and subscribe. This health series is designed step by step, and following it fully will help you get the complete picture of the treatment. See you in next episode of Vaginal Atrophy 101 with Dr. Emily.